Hi, hello, welcome to another video, and here I will read and look at the abstract of this article, which was published in Movement Disorders Journal. I think this is the most prestigious, one of the most prestigious movement disorder journals, and it's like quite a non-profit journal, seems to be. And the authors are from the US, and recent years have witnessed increased antipsychotic treatment of children. So it's about in children treated with atypical antipsychotic medications. So it's a side effect of the schizophrenia, and some children are treated with it, and therefore there are some. It's possible to observe tardive dyskinesia in those children. Recent years have witnessed increased antipsychotic treatment of children despite limited long-term safety data in children. In this study, motor side effects associated with the use of antipsychotic drugs in children were examined in a sample of pediatric psychiatric patients. Child and adolescent psychiatric patients receiving antipsychotics, most were on atypicals, I think, to reduce the risk of tardive dyskinesia for 6 months or longer, were compared with antipsychotic naive patients with similar age, sex ratio, and diagnosis. Only 19% of patients on antipsychotics had ever experienced psychotic symptoms. Um, 11 children on antipsychotics exhibited dyskinesia, 9%, when compared with 0 in the naive group, and it's well known that when they are getting older the risk is higher, but it seems to be there's a risk for children as well. 9 of 62 African American children on antipsychotics exhibited dyskinesia. They emphasize the race difference when compared with only 4% European American children. So children treated with antipsychotics, but some can infer from this information, but I think the sample size is very low to just generalize the findings about the race difference. Children treated with antipsychotic drugs might experience a significant risk of dyskinesia even when treated only with atypical antipsychotics. Ethnicity might also be a risk factor for dyskinesia in children. Side effect profile of the atypical antipsychotics in children may be much different than that in adults. So that's interesting. So they can also compare it with other races and see the results. I think and I want to know how old are they, but I think we cannot see how old the children are, right? We cannot see, I guess. And thanks for watching this video. I hope you enjoyed this article, and so if you want to read more article, you can click my website, and then you can find relevant articles written on tardive dyskinesia. Have a beautiful day. Bye bye.